Hi, everyone. Thanks for taking the time to join us today. I guess as we wait for people to file in, I'm just gonna hold off presenting until like 1:05. Um, but yeah, we have with us today Danielle and Kevin from RUHS, who will be sharing with us some resources on the vaccine, how it works, and about COVID and long COVID, and the best steps we can take to protect ourselves from um, those severe health effects that can happen if you get infected with COVID. Um, and yeah, at the end of this session, which probably will go like 35 minutes, I'll follow up and send you all the link to our resources page, which will include list of upcoming vaccination clinics and some free and no insurance resources for treating COVID in the Riverside area. Um, Hello, Erica. Thank you for joining us. And we also have with us Erica from Starting Over and Jose and another community member who will be sharing a little bit about their experiences with getting the vaccine and about why it matters to protect ourselves and each other from getting COVID. Thank you everyone for coming out. And also, um, as a reminder, the gift card incentives that you're eligible to receive for attending this webinar, which are $25 ARCO gas cards or Winco grocery cards, are only available for pickup at the Starting Over office in Riverside before next Friday. So again, we're not able to email or mail out the gift cards. Unfortunately, it has to be in person. Thank you for your understanding and thanks again for being here. I think maybe we'll wait another like 3 minutes and then we can go ahead with the presentation. Oh, and also there will be time for like questions at the end. So if you have anything you want to ask our health experts or community members, feel free to use the chat or the Q&A button at the bottom and we'll try to get to them all. Sorry about that. Oops. Okay, let me pull up the slides. Wait, sorry, Danielle, are you able to pull up the slides? It's not showing up as an option for me in the screen sharing for some reason.
Yes.
Thank you so much. Awesome. Okay, maybe we can go ahead and get started.
Hi, good morning.
Oops.
To provide a deeper understanding, now let's discuss the COVID-19 vaccine.
Sorry, one.
That was happening to me too.
You ready?
Yeah, let's go. Okay, thank you, Danielle.
Hi. To provide a deeper understanding of the coronavirus, also referred to as COVID-19, coronaviruses are a type of virus with a crown of spike proteins sticking out, as referred to in this picture provided on the left of the screen. There are many types, including SARS, MERS, and viruses that cause colds. SARS-CoV-2 is the specific coronavirus that causes COVID-19. COVID-19 causes respiratory symptoms, but can also harm other parts of the body. Now let's discuss the COVID-19 vaccines. A few frequently asked questions we receive regarding the vaccine are, how do vaccines prevent illness? What are some reasons a person might get a COVID vaccine? How safe and effective are vaccines against COVID? COVID-19 vaccines help the body to develop immunity to the SARS-CoV-2 virus. They provide strong protection against serious illness, hospitalization, and death. Side effects are generally mild, and vaccines are very safe and effective. There are currently 2 COVID-19 mRNA vaccinations, which include Pfizer and Moderna. These mRNA vaccination enable cells to produce spike proteins using the instructions from the mRNA. Immune systems build antibodies to fight against the spike proteins. So in the event if a person is exposed to SARS-CoV-2 later, the immune system remembers the spike proteins and can quickly build antibodies against it. This flyer provides a deeper understanding on how mRNA COVID-19 vaccines work. Coronavirus, like the one that causes COVID-19, are named for the spike-like proteins on their surface called spike proteins. These spike proteins are ideal targets for vaccines, as seen in the provided picture. Messenger RNA, also referred to as mRNA, is the genetic material that tells the body how to make proteins. The vaccine is made up of mRNA wrapped in a coating that makes delivering easy and keeps the body from damaging it. This vaccine does not contain any virus, so it cannot give you COVID-19. It cannot change your DNA in any way. How does the vaccine work? The mRNA in the vaccine teaches the cells how to make copies of the spike proteins. If you are exposed to the real virus later, your body will recognize it and know how to fight it off. After the mRNA delivers the instructions, the cells break it down and get rid of it. When your body responds to the vaccine, it is sometimes causes symptoms like mild fever, headaches, or chills. This is completely normal and is a sign that the vaccine is working. COVID-19 protein subunit vaccines. Vaccines from Novavax are a protein subunit vaccine that contains harmless copies of the COVID-19 spike protein. The vaccine contains an ingredient called adjuvant, which helps the immune system respond to the spike protein. Immune systems build antibodies to fight against the protein. If a person is exposed to SARS-CoV-2 later, the immune system remembers the spike protein and can quickly build antibodies against it. No vaccine is 100% effective, but people who are up to date with their COVID-19 vaccine have a lower risk of severe illness. The attached flyer provides a deeper understanding of protein subunit COVID-19 vaccines and how they work. As previously discussed, coronavirus, like the one that causes COVID-19, is named by its crown-like spikes on their surface called spike proteins. These spike proteins are ideal targets for vaccines. What is a protein subunit vaccine? Protein subunit vaccines are a type of vaccine that cause harmless copies of the COVID-19 spike proteins. These vaccines do not contain the entire virus. The vaccine does not contain any live virus, so it cannot cause you to get COVID-19. What is in the vaccine? The vaccine contains virus pieces called spike proteins and another ingredient called adjuvant. How does it work? When you are vaccinated, nearby cells pick up the proteins. The immune system recognizes that the proteins do not belong. The adjuvant helps the immune system produce antibodies and activate the other immune cells to fight off future infections. Once vaccinated, our body recognizes the protein should not be there. Antibodies will fight the virus that caused COVID-19. Again, when your body responds to a vaccine, it sometimes causes side effects such as fever, headaches, and chills, and these are completely normal and mean the vaccine is working. Vaccine recommendations for age groups. Moderna and Pfizer's 2024-2025 COVID vaccine is available for everyone ages 6 months and older. Novavax 2024-2025 COVID vaccine is available for everyone ages 12 years and older. Let's discuss post-COVID conditions, also referred to as long COVID. Long COVID is broadly defined as signs, symptoms, and conditions that continue or develop after initial COVID-19 infection. Symptoms are present 4 weeks after the initial phase of infection. Long COVID is not one condition. It represents many potentially overlapping entities, likely with different biological causes and different sets of risk factors and outcomes. Long COVID prevention measures include the COVID-19 vaccination, as well as oral antiviral treatment. Paxlovid has been linked to lower the likelihood of getting long COVID. There are many symptoms that develop from long COVID, but the most common symptoms include fatigue, headache, brain fog, depression, poor sleep, shortness of breath, and chest pain. Unfortunately, there are currently not any approved medications for long COVID, but healthcare providers can provide care to reduce symptoms of long COVID. For most people with long COVID, the goal of medical management is to optimize function and quality of life. COVID-19 treatments. COVID-19 treatments, also referred to as oral antivirals. What are oral antivirals? Oral antivirals are pills that stop the virus that cause COVID-19 from making copies of itself in your body. 2 oral antivirals are available. Paxlovid, which is for adults and children 12 years of age and older. Lagevrio is for adults 18 years and older. A few commonly asked questions regarding oral antivirals are, what is the time frame I should start taking oral antivirals? Both Paxlovid and Lagevrio should be started from the first day of symptom onset up to day 5 of symptom onset. How do you get an oral antiviral? Oral antivirals are available with a prescription from a healthcare provider, and Paxlovid may be prescribed by a state licensed pharmacist. Patient assistance programs for COVID-19 treatments are available. There are 2 patient assistance programs offered through Pfizer. There's a Pfizer co-payment savings program, which is for privately insured and commercially insured patients, where the payment can be as low as $0 for a co-payment savings program, but you must sign up for this. Additionally, the U.S. government patient assistance program called USG PAP, which is operated by Pfizer, is also available for patients who are uninsured and USG PAP operated by Pfizer to receive Paxlovid at no cost. Underinsured patients with high co-payments for Paxlovid and cannot afford the medication are eligible. Eligibility for uninsured and underinsured patients is also based on household income at or below 300% of federal poverty level.
What happened?
Can you hear me okay?
Uh-huh.
Oh,
Um,
I think I lost Wi-Fi for a second.
oh, it's all good.
Let me,
See. Thank you, Danielle.
Mhm. Sorry about that, everyone.
Sorry.
Was this the last?
Uh-huh.
Being a co-payment savings program, which is for privately insured patients to save on their out-of-pocket cost for their prescription. Additionally, they offer a patient assistance programs for patients who are suffering financial hardship and would not be able to afford the medication otherwise. All of these patient assistance programs, including Paxlovid and Lagevrio, require applying for the program prior to getting the prescription. Let's discuss a few resources. RUHS Public Health has a few websites covering all of the information I have discussed today. The QR code on the left of the screen goes over any upcoming clinics that we have scheduled for the community. By scanning the QR code or by clicking on the attached link, it will take you to the website. When you scroll down to the bottom of the page, you'll be able to see the location of the clinics that we have available, along with the vaccines that we will be providing to the community. The QR code on the right of the screen goes over additional details surrounding post-COVID treatment options. You can either scan the QR code or click on the link provided for post-COVID treatment options. And last but not least, RUHS Public Health has a COVID-19 treatment options webpage that discusses the treatment options and available resources in greater detail. By scanning the QR code or clicking on the link provided will take you to the website and go over specific details surrounding COVID-19 treatment. On behalf of Riverside County Public Health Immunizations Branch, it has been a pleasure discussing this valuable information with you today, and we are available for any questions that have arose.
Thank you so much, Danielle, for that presentation. So I know even though like it seems like a lot of people have stopped talking about COVID, in the last couple of years. I mean, we're all tired of like hearing about it, but that doesn't mean that it's gone away. So as like in the slides, COVID can have really debilitating effects on your health and like possibly for years to come that we don't know like the full impacts of yet. And I wanted to share some stats with you all that since the start of the pandemic, 110,586 Californians have died of COVID-19. And just in the last 90 days, 573 state residents have died. So this thing is still around, and we still have to take all the precautions we can to protect ourselves and each other from the severe impacts of COVID, especially as some people with weakened immune systems who cannot get the COVID vaccine rely on other people to kind of get vaccinated on behalf of them. So there's less risk of like the COVID spreading and acquiring it. And although about 73% of Californians have already gotten like your first COVID shot, like as of this month, only 13% of Californians are up to date on our COVID vaccinations. So those resources Danielle shared are up on our website, and you can go see how to make an appointment and some upcoming vaccination clinic dates if you'd like to go get your updated booster, which, yeah, I forgot the name of it, but it's up there. And Now we're going to hear some community members on their experiences getting vaccinated and with COVID. And I think Jose, maybe we'll hear from you first since you might have to go soon.
Okay, I can start.
Mhm.
Well, I got vaccinated. I got both of them. I got the Pfizer and the Moderna. Um, uh, with with one of them, like my arm started hurting for like a day, but then the next day it was fine. And then when I got COVID, I got I got fever and a cold, but it went away in like 2 days, and then I was fine. Um, I I I was in isolation in my room for a couple of days. Um, but I know it's COVID is dangerous because one of my uncles is on dialysis because of COVID, and then a couple of friends of mine that I know have died from COVID. I know my brother doesn't believe in the vaccination, but I do. So me and my mom we get vaccinated whenever we get a chance. Um, yeah, pretty much.
Thank you for sharing that, Jose. And I'm really sorry to hear about your loved ones. And it's really great to hear that, you know, you're taking steps like with your community members to make sure that like even for the people who can't get vaccinated, like other people around them can. And that also helps to keep like our whole community safer. So thank you so much for sharing, Jose.
You're welcome.
Erica, would you like to share?
Yeah, so in January 2021, I tested positive for COVID, but I think that things have changed because I went to go get tested and they said that I had COVID and the flu beat and I felt well. And I said, "Are you guys sure this is right? Because I feel fine. Like I've never had the flu and been sick." But anyway, in January 2021, my mother tested positive for COVID. I was on my lunch break at work, and I got a call that she couldn't breathe, and so I had my daughter call 911, and the ambulance came to take her away. And by the time I was able to get to the hospital, she died. So they couldn't save her. I asked, did they resuscitate her and bring her back? And they said that they did. And I told them that I wanted them to test her for COVID because she had been sick, but she did not have any of the classical symptoms of COVID, you know. And it's interesting being a person of color. When she arrived to the emergency room, her oxygen level was at 56%. My mother had freckles all over her face and freckles on her lips, so we could not tell that she was losing oxygen. So my mother died, and then when my mother died, that same day my boyfriend stopped breathing and he had to be hospitalized with COVID pneumonia. And so I tested positive for COVID, and my youngest child tested positive for COVID. And so with my mom only being 56 years old, no pre-existing medical conditions, no diabetes, I decided to get vaccinated because I wanted to make sure I wasn't harming anyone. I was told that and then during that season, I had tested, you know, I have children. So in order for them to go somewhere and come back, they had to be tested because my mother died at 56 from COVID and she was healthy. She was well. She was hot. She was beautiful. So they always tested. Everyone always came back negative. But I tested positive for COVID about 5 times and I was never sick. And even when my boyfriend was sick and hospitalized with COVID pneumonia, we slept in the same twin size. No, we have a full queen size bed. We slept in the bed together and he was dying and I was fine. So it's an interesting disease. I got the Pfizer vaccination because I wanted to know that I wasn't going to harm anyone when I would come around my other family. And I do believe that being vaccinated has just let me know that I could feel free to go around people and I wasn't putting anyone in danger. And I also wanted to ensure that I was increasing my life expectancy. Definitely want to live to be past 56 years old. And I think that COVID is something that is not to be played with. Sometimes people take it too lightly. The day that my mother died was my former mother-in-law's funeral. And so it's so funny because I have a son who's 24 and he still doesn't want to get the vaccine. I said, both your grandmothers died from COVID. You don't want to get the vaccine, son? He was like, "No, mom, it's okay. I'm not afraid to come around you if you have COVID." So I do think that education is very important for the young people and the younger generation. As the previous gentleman said, his brother doesn't believe it. It's like, well, how many people need to die before you realize that it's serious, it's real, and it's not, it's, people are leaving here. So I'm just very grateful that the vaccine was available so that I could do something to not be feeling consumed that I may harm someone or I may put someone's life in danger.
Well, thank you so much for sharing that, Erica. And I'm so sorry for your loss. Yeah, COVID really has done like a number on our community members. And like as we know, there's so much misinformation going on about the vaccine. It does sound really scary. Like, I don't want my DNA to be edited, or all the myths going around about the COVID vaccination. And I think there is a lot of validity in being like unsure about like something new, because we do know like a lot of medical racism exists. Like he said, like they didn't um realize your mother's oxygen levels were changed. But like people of color are dying at like disproportionately high rates from COVID. So it is really important to take all the steps that we can to protect ourselves and our loved ones from severe illness, because like he said, like COVID is not something to be played with. We don't know like all the we don't know fully yet like how it affects your body. Like we know it's impacting people's um like their hearts and lungs and organs in ways we never anticipated. So um like yeah, I just encourage everyone to not like believe all of the like scary things we might see on social media about COVID. And if we've any questions, now is a great time to ask our health experts. And I see we already have yeah, so feel free to put those in the Q&A or the chat. And we had 2 questions from Dylan that maybe we can answer now. Dylan wants to know, what are the long-term effects of COVID-19 on global economies and societies? And how have governments and health organizations adapted their strategies to combat COVID since its emergence?
Hi everyone, my name is Kevin. I'm a registered nurse with RUHS Public Health with the immunizations program. And to your question, it's kind of hard to say, long term as far as the economy and society. But what I can say is that, COVID-19, it's been, I believe I saw the other day that it's already been, I think it was like yesterday or 2 days ago, where it was exactly 5 years since the first, the announcement of the lockdown for COVID. So it's already been 5 years, and it's still it's here to stay, and it is still affecting a lot of people in a lot of communities. So we are still trying to, and for most people, we're kind of back to business. A lot of people are not really thinking about it, but as public health, we are really trying to make sure that we're still recommending the COVID vaccinations, and then also to prevention strategies. So, very common, practices, infection prevention practices, making sure that you continue washing your hands frequently, wearing a mask if you're don't feel safe around large crowds or you're in an indoor space. Wearing a surgical mask or an N95 well-fitted mask helps to protect as well. And then if you're feeling sick, like if you have symptoms, just staying home and not going to work, and getting that rest and time to be away from others if you're feeling sick. So we're still continuing to recommend those things. And then as the presentation highlighted too, there's also, treatment options for those who do get COVID, that maybe Danielle can speak to as well if there's more information. But it's been around for 5 years now, and it's here to stay. So we're just continuing to provide resources for all patients, whether they have insurance or not. Resources are available out there.
Thank you, Kevin. Thanks so much for that. I wanted to add that we also have, like Erica mentioned, like sometimes you don't know if you have it or not, like it's severe. Sometimes it can be asymptomatic, but you can still pass COVID to people and like be totally unaware that you had it. So it's important to keep getting tested. We have a lot of free tests available at the Starting Over office, as well as masks and hand sanitizer, and also children's masks. So when you come to pick up your gift card, feel free to ask for any of those resources because we have a ton. And also we have, a link to some of those resources Kevin mentioned on our website that I'll be sending out as a link. And also I wanted to add that I noticed when putting together some COVID information for outreach we were doing in the last couple months, it does seem like a lot of like government and health organizations have either like lost like funding maybe or like focus on COVID because a lot of the resources out there now seem to be like a couple years old or outdated, or some of the programs available for people. Like I think the free, it's like some of the free vaccination clinics, like the programs, they kind of phased out. And also like some of like the tracking of the like population numbers of like rates of COVID are not really being tracked anymore. So even if you don't see COVID like, as prominently in the news anymore, or like about the numbers of people getting it, it's still very much like a real problem in our communities. And there are still vaccines, like updated vaccines being created to combat like the new strains of the virus. So it's just always important to remember like COVID is still here, it's here to stay. And we have to keep protecting ourselves and each other, even if it seems like, like federal and whatever, like a lot of like public resources seem like they're not focusing on it as much anymore. And thank you, Kevin. Are there any more questions people have about COVID or the vaccine?
Emma, I did want to add to real quick. You had mentioned updating of the vaccine, and that's something I like to really stress as well, because even among community members who do believe in the vaccine, but maybe they are getting that fatigue, they might think, I already got my 2 doses, I'm good, or they've already received maybe 1 or 2 of the boosters and they're feeling okay. But like you had mentioned, it's gonna be like a seasonal flu, where they are looking at what's the current strain that's going around, and that's making people sick and infecting the community. And so it's not so much about how many COVID vaccines you've gotten already. It's going to be a yearly seasonal thing. So like you brought out the statistic about only 13% of the state of California are up to date, meaning that they receive the current 2024-2025 COVID vaccine. And so we're really trying to kind of get away from the idea of like I got my booster, I'm good, I already got it. It's going to be a seasonal thing. So it's just trying to let community members know that there is a new COVID vaccine available for the season. If you haven't gotten it recently, we do recommend it. And then, it's going to be like that every year, where it's going to be a new formula, similar to like a flu shot.
Thank you for that, Kevin. Yeah, it's great to remember. It's not like one and done, but we just got to keep doing it every year because it keeps, virus keeps changing in new ways that we got to protect ourselves from. Erica, did you have a question?
Oh, I was just gonna say I'm grateful to be here and learn that I do need to be vaccinated, because I am starting to see things about for dental appointments and doctor appointments. If you're experiencing COVID symptoms, stay home. So that's something that's starting to be on the rise. So I'm grateful to be here so that I can make me an appointment for that booster, because I just realized, it's been many years since I've gotten those vaccinations, and the virus continues to change, and I want to stay well. So I have to do what I need to do. So thank you.
Thank you, Erica. Yeah, we're glad to have you here, and it's a good reminder to us all to make those appointments. Okay, Johnson asked, how does the virus replication process influence the development of antiviral therapies?
That is a very great question. I think I would need to do a little bit of research before feeling comfortable with answering that. But I can send you guys an answer to that question once I find out and ask around a couple doctors and stuff.
Okay, thank you, Danielle.
Mhm.
Yeah, Johnson, I can send, yeah, I'll try to send out the answer to that question in the follow-up email to this webinar. Okay, Dylan also had another question. What role has technology played in mitigating the spread of COVID, and what innovations can we expect in the future?
That's a good question. I think that's something we can also do a bit more research as well, as far as technology goes. So you know, we can get back to you as well for that question. I'll do more research as well.
Thank you, Dylan, and thank you, Kevin. Okay, Hazel also had a question that I feel like ties in a little bit to Dylan's, which is why hasn't public health not issued mandatory masking at restaurants, clinics, and/or hospitals to protect the public? So I think like an innovation that we already have that works like very well is just masking, like masking more. I mean, I think everyone probably is tired of like remembering the time when we were all masking all the time or it's being reminded to mask, but it really does work. Like I was visiting my family in Asia a couple of weeks ago, and it was like flu season, so like most of the people were just wearing masks, and you know what, they got sick way less than I think is normal here. So um, like masks are already like a really great innovation um, that are like here to stay, that I encourage more people to use if you're going somewhere really crowded like public transportation, or like going to visit someone in like maybe like a retirement home or in a hospital where people are more vulnerable to like catching COVID. Um, but yeah, okay, Hazel says they were referring to employees mandatory masking at like public areas to protect the public. Danielle or Kevin, do you have thoughts?
I think it can be a bit of a complex thing because when it comes to mandatory masking, I think it can also come down to the state as far as some of the mandates that they can issue, and a lot of it can be related to you know, the data as far as how prevalent the COVID disease is going around. So like in respiratory virus season, um, at least with public health and the on our employee side, we do have masking guidance. So when we're out of respiratory virus season, it's a recommendation, but it's not a requirement. Um, and this is for like on the employee side. And then when it is respiratory virus season, if we do see patients, so like I work with patients, I can see patients at our vaccine clinic. So we do want to wear masks in order to protect those who are immunocompromised. And then as far as, you know, for the public, mandatory masking for the public, that part I'm not 100% sure. I think it could just depend on um, how much COVID is going around. A lot of if there's like outbreaks going on, then and it's really impacting a large amount of people, where maybe the state might do like a mandate. But as of right now, it's recommendations, but not necessarily you know, mandatory. But we do recommend, you know, you know, if you have masks should be available. So um, if you have masks available, and a lot of, you know, community partners, I know Starting Over provides resources as well, like masks available. You know, if it makes you feel comfortable, then it's recommended that, you know, you take those precautions, because sometimes you can't force another person to wear a mask because they may not want to. So then you do your own protection to protect yourself.
Thank you so much, Kevin. Yeah, I think we saw from 2020 how even when at a lot more like public and private areas, masking was required, a lot of people still would like refuse to comply, unfortunately. So I think it's just up to us to like mask when we can and encourage people we know to also do that. Because yeah, it's ultimately up to us to protect each other from COVID. If we can't implement like these like like sweeping like COVID protection measures anymore. It's kind of down to like individuals now to like talk to your community about why it's important to mask and get vaccinated so we can all prevent severe illness. Because as we know, like getting infected with COVID over and over again kind of has like it could have unknown like long-term impacts on your body. So are there any more questions before we close out? Okay, Dylan has one. We're glad to have you here. Also, Dylan, Dylan says they ask a lot of questions about this, but hasn't been able to find a good answer yet. How can individuals and communities work together to build resilience and support each other in the face of future pandemics?
I think it's a really good question, and I think this is a good starting point. I'm really grateful that we have this presentation and we're able to provide this to you all attending this presentation, and also provide that education and resource. And then we're able to partner with Starting Over. We're at the public health county level, and we also partner with a lot of other organizations. So I think as long as we continue to build relationships with the community, with community partners, that we're all kind of under this one mission, this one kind of mindset to make sure that we're um, educating the community, providing resources to the community, and then you as individuals can share what you learn and share it with your family and friends to help spread the word about and combat misinformation and things that are kind of going around that maybe might deter people from getting the resources that we're trying to provide. So well, it starts with you all, and the information that you receive, and trying to share that with others as well. So I'm grateful that we're having these presentations for you guys.
Thank you so much, Kevin. That was really nice. And I think that, yeah, like to protect each other in the future and like build up that community resilience, I think we really have to like listen to each other. And sometimes we're gonna be like inconvenienced or do things that we don't really want to do, like wear a mask or get vaccinated every year. Like, is it kind of annoying and like time consuming or like uncomfortable or whatever? Yes, but we're doing it for like the greater public health of each other. And I also think that we need to be looking to people most impacted and vulnerable to diseases, which I think are disabled people and people inside prisons and jails, who don't have like full autonomy over what they're exposed to or their health. So I think just always being aware of who is the most like impacted by these diseases and always advocating for them is one of the most important things we can do to keep our entire community safe. Because we're not free until all of us are free. So I think we have to look at like everyone when we're thinking about how to protect each other. Also, I just realized I forgot to share our last community presenter. So I'm going to share a quick video from Larry, who was not able to be here today, but sent in a very nice video. So I'm going to pull that up really quick. Sorry, 1 second. Okay. Oops. Do I share? Okay. Can you see my screen?
Yes.
Okay, I'm gonna share this quick video from Larry, and then I will let you all go. Okay, let me know if anyone has trouble hearing this.
Good morning. My name is Larry Garza. I'm a formerly incarcerated person. Um, I was incarcerated for 35 years of my life, being from 1990 to February of this year, 2025. So I'm here today to express my opinion in regards to the COVID. I was incarcerated during during the time of COVID, seeing the many changes, the many effects that COVID has had on my life, on other incarcerated persons' lives, family members, friends, society, to the many people that were affected and continue to be affected by COVID. This disease, it continues to take its toll on family members and society in general. Well, what I'm here today is to talk about my experience with COVID, with the vaccines, with being vaccinated. When COVID did come out, I was infected with the COVID virus. Though I was asymptomatic, I was still infected with it. At that time, I was still capable of passing it on to other incarcerated persons, as well as staff. There was a lot going on during this time. I know a lot of people had their feelings and their views in regards to getting vaccinated, whether they chose to be vaccinated or chose not to be vaccinated. My opinion is, this is my own personal opinion, I believe it's the right thing to do is to be vaccinated. I believe being vaccinated prevents a lot of others from being sick, yourself as well from being ill, from being able to pass it, being able to have yourself infected and have the many dangers of COVID that we deal with in life today. I know for me myself, being a person who is today in society, I'm still making a transition into society. Though I take it very serious when it comes to this COVID with this disease, and this is very harmful to a lot of people. I look at it today as the opportunity to do my part, and my part of giving back to the many lives that I affected in the past. For me, spending time being incarcerated for the reason I was. So now I look back and I look at this as an opportunity to do my part and speak up in regards to the COVID vaccine. And I would ask that continue to give the vaccine, continue to push forward with giving us the opportunity to be vaccinated, because I believe it helps us as well as others in regards to saving lives, finding better solutions to be able to deal with this COVID. And I believe this is one of the solutions to possibly staying healthy. COVID has affected many lives, taken the lives of many. Experiences in institutions that I have witnessed people leaving with COVID and never coming back and never to be seen again in regards to COVID affecting them the way it did. So I believe strongly the COVID vaccination is very important to myself, to others, to society. So my opinion is I agree with the vaccination, and I thank you for your time in this matter and allow me to speak. Have a great day, and I appreciate it, your time. Thank you.
Okay, thank you everyone for being here. That was our last speaker. I appreciate everyone staying through this whole time. Again, I'm going to be sharing out the resources mentioned and also instructions on how to pick up your gift cards and some of the other COVID resources that we have available at the office. Yeah, so thank you everyone for your time, and thank you to our amazing panelists for all the information that you shared today.
Thank you, everyone. Bye.
Thank you.
Thank you, everyone. Have a nice day.